medicine وهي and these signs. Today we'll talk about an important clinical signs which are number one the Tinel sign. Tinel sign. هكلم عن التينل ساين وعن الفالنس ساين أو الفالنس تيست. التينل ساين والفالنس تيست these two signs or procedures they are met with in patients with carpal tunnel syndrome. Carpal tunnel syndrome. والcarpal tunnel زي ما احنا عارفين this is a tunnel which is present at the rest below or posterior to the flexor retinaculum اللي هو بيعدي منه ال four tendons of the flexor digitorum superficialis والflexor digitorum profundus. four tendons من كل واحدة من two muscles دول والtendon of flexor carpi ulnaris. يبقى في 9 tendons ومعاهم الميديان نيرف. دول ال structures which pass through the carpal tunnel أو deeper to the flexor retinaculum. إذن الميديان نيرف معاه 9 tendons of muscles اللي ذكرتهم الفلكسور ديجيتورم سوبرفيشياليس والفلكسور ديجيتورم بروفاندس والفلكسور كارباي الناريس. دول مع الميديان نيرف موجودين في الكاربال تانل. لو الميديان نيرف compressed أو irritated due to compression by any tissue في الكاربال تانل، وده بيحصل في حقيقة نتيجة لأسباب كثيرة منها الإديماتوستاتس الميكسيديما idiopathic cases any swelling موجود في أو any tissue accumulation في الكاربال تانل will compress the median nerve and causes the what we call the carpal tunnel syndrome. وبيبقى فيه الميديان نيرف irritated due to its compression نتيجة لضغطه في الكاربال تانل تحت الفلكسور ريتيناكولم، وبالتالي بيعمل manifestations في distribution of the median nerve. زي ما احنا عارفين هو بيسبلاي muscles of the thinner eminence وال 3.5 lateral fingers. that is the thumb والindex والmiddle والlateral part of the ring finger. ففي حالات الكاربال تانل سندروم بيبقى في tingling ونمنس that is pins and needles in the distribution of the median nerve together with weakness of the thinner muscles. المسل الموجودة في الثينر eminence اللي هي supplied بالميديان نيرف. in contrast طبعا زي ما عارفين الهايبوثينر muscles دي supplied by the ulnar nerve اللي هو C8 و T1. الميديان نيرف اللي هو بيبقى compressed which is compressed in carpal tunnel syndrome when it is irritated due to its damage or compression in the carpal tunnel زي ما قلت تحت below to the flexor retinaculum or deep to the flexor retinaculum. It will cause this tingling and numbness and maybe pain in the early stages due to irritation of the median nerve. وبعدين later stages بيبقى فيه العكس، بيبقى بعد ما كان في after pain and tingling and numbness ممكن يبقى فيه hyposthesia في this area if it is completely damaged. Depends on is it early or late. In the early phases there is usually pain and paresthesia, that is tingling numbness. In the later phase there is hyposthesia in the distribution of the median nerve. How can we elicit this clinically? By the Tinel sign, what we call Tinel sign, Tinel''S sign. And here we tap. اللي بنعمله في Tinel sign to detect irritation of the median nerve, we tap over or we percuss over the median nerve at the flexor retinaculum. We percuss like that on the median nerve. ده الفلكسور retinaculum هنا في المنطقة دي، وتحته في الميديان نيرف. وسوبرفيشال زي ما احنا عارفين في الالنر ارتري اللي هو بيدخل على الهاند وبيدي السوبرفيشال plantar plexus مع السوبرفيشال برانش بتاع الراديال ارتري. اذا الالنر ارتري بيباس سوبرفيشال للفلكسور retinaculum. الميديان نيرف بيباس deeper to the flexor retinaculum. وبالتالي لما بيكون في carpal tunnel syndrome اللي بيتضغط هو الميديان نيرف وبيمهس. ازاي نقلست بالتينل ساين like that. We percuss the irritated median nerve at the flexor retinaculum. This will reproduce pain and tingling in the distribution يعني في المنطقة دي اللي هي منطقة الثumb و 3.5 fingers دول المنطقة دي. This thumb, index, middle and the lateral part of the ring finger. يبقى في paresthesia in this. This is Tinel sign. الفالن sign أو الفالن test, this is another clinical sign. هنا we hold the dorsum of both hands like this with the wrist joint flexed at 90 degrees with the wrist joints like this exactly. بنعمل كده اهو وبالتالي this is here the wrist joint is flexed at 90 degrees angles together like that. There will be لما بنعمل كده هنا بيحصل more compression over the median nerve وبالتالي بيدي برضو pain and paresthesia في distribution of the median nerve. This is called the Phalen's test. This is called the Phalen's test. Phalen, P-H-A-L-E-N'(S). Phalen test أو الفالن sign. يبقى الفالن test like this. This is holding the dorsa of both hands together like this for 30 to 60 seconds لمدة يعني نص دقيقة لدقيقة maximum. This will reproduce the paresthesia and pain, tingling in the distribution of the median nerve in this area, in the thumb, ring, middle, and the lateral part of the ring finger, as I mentioned before. This is how to reproduce the physical signs of median nerve compression. So this is Phalen's test, holding the dorsal of both hands together like that. This will produce tingling and pain in the distribution of the median nerve اللي هو المنطقة دي بالظبط بيحصل فيها شكشكة وتنميل. There will be tingling and numbness and maybe a vague pain also when we hold the hands like this or the wrist joints like this at 90 degrees. This is the Phalen's test. So this is the Phalen's test. والتست اللي قلته the first one is by percussing the compressed median nerve. This is Tinel sign. So Tinel sign is percussion of the median nerve at the flexor retinaculum to detect its compression and irritation. The Phalen's test is like this. So this is the difference between Tinel sign and Phalen's test, which are important for diagnosis of CTS أو carpal tunnel syndrome, and it indicates irritation of the median nerve. لما نيجي ل another sign, the third one is called Allen test. The Allen test is another physical sign listed here also in this region, ولكن this is to detect the patency of the ulnar and radial arteries, the arterial supply of the hand. لأن احنا عارفين the hand is supplied by the radial and the ulnar arteries. The ulnar artery, the radial and the ulnar share in the arterial supply of the forearm هنا. But the ulnar is the predominant and the main artery of the forearm. Also, the radial and the ulnar artery supply the hand, but the predominant artery of the hand is the radial artery. But both share together. How? By the what we call the plantar plexus, the superficial plantar plexus, which is formed mainly by the ulnar artery together with the superficial branch of the radial artery, and another plantar arch deep inside the hand called the deep plantar plexus, which is formed mainly by the radial artery, the opposite, the radial artery with the deep branch of the ulnar artery. So the deeper tissues of the hand is supplied by the radial artery through its contribution to the deep plantar plexus, and the superficial tissue of the hand is supplied by the superficial plantar plexus with the ulnar artery, the main contributor to the superficial plantar plexus. To detect the patency, عشان نشوف إذا كان الulnar والradial patent ولا لا, to detect patency of the ulnar and the radial, we do what we call the Allen test. The Allen test by putting the both thumbs like this at the radial and the ulnar artery. We all know that here is the radial artery at the lateral part, and here in the medial part of the wrist, here is the ulnar artery. So we put the thumbs at then, and then we compress, and then we release each of the thumbs in turn to detect whether there will be plunging of the hands or not, to detect any incompetence or any occlusion of the ulnar and radial arteries. This is called the Allen test. Allen test. So the Allen, and there is also what we call modified Allen test. So Allen test and modified Allen test are used as a clinical test to detect and to assess ulnar artery and radial artery patency at the wrist, and to detect any occlusion of any of these two arteries, the radial and ulnar, by the Allen test and modified Allen test. That's what I wanted to present today about important clinical signs at the wrist. Two for the nerves, mainly, namely the median nerve, the Tinel sign and the Phalen test, and one test for the radial and ulnar arteries, which is the Allen test. يبقى أنا النهارده قلت اتكلمت عن الألين تest والفالين تest والتينل sign. Important clinical signs here, which might be used to detect important clinical conditions of the nerve supply of the hand and the arterial supply of the hand. Tinel sign and Phalen test for the median nerve irritation in cases of carpal tunnel syndrome, and Allen test for, and the modified Allen test for detection of any occlusion of the ulnar or radial arteries, also at the wrist joint. So the Allen test, don't forget the Allen test for the radial and ulnar arteries, and the Tinel sign and Phalen test for the median nerve.